Welcome back to Across Louisiana. You know, here in the Baton Rouge area, perhaps no other institution does more for the treatment of cancer than Mary Bird Perkins, Our Lady of the Lake Cancer Centers. And here to tell us what they have coming up this month for colorectal cancer awareness is Dr. Nelia Moretti. Welcome to the show.
Thank you for having me here.
You know, people are familiar with the name Our Lady of the Lake and certainly Mary Bird Perkins. Talk to the folks a little bit about the range of treatment that you do.
I'm actually part of the colorectal multidisciplinary cancer care team, which is a panel of experts. We meet and provide. Our main goal is to provide increased awareness of colon cancer in the community. So almost everyone should know that they need a colonoscopy at 50 years of age, whether or not they have any symptoms. It's almost mandatory. It's the best way to prevent colon cancer and to diagnose it early. And if you have any high risk because of the symptoms, or if you have a family member who has colon cancer or polyps, you need to get it done at 40 years of age. So we want to get this message out to everyone and also provide the latest guidelines to primary care physicians. That's what the colorectal team is doing at this point.
So it's more than just prevention. I mean, you're doing education and you know, really it's all encompassing, right?
Exactly. We want early diagnosis and treatment, and we also the Cancer Center provides free colon cancer screenings for patients who don't have insurance. If you go on their website at Mary Bird Perkins or at, there's a phone number 215-1234 where they can call and find out when they can get free colon cancer screenings as well. So we want to increase the rate of colonoscopies that are done because Louisiana is pretty backward in that as well. And we also focus on genetic testing for patients who have early cancers and other colon cancer, other cancers that are associated with colon, like breast, uterine, kidney cancers, which may be part of a hereditary syndrome, and other family members may be affected too.
How pervasive of a problem is colorectal cancer around?
It is very common. About 150,000 people diagnosed every year, and up to 50,000 people die. So our best effort is prevention and early diagnosis. And there are some patients we see them for screening because they're not having any symptoms, and they're just there because they're 50 or 40 because they're high risk with a family member. And they can get cancer diagnosis very early, and sometimes they get away without having to do any chemotherapy, things like that, if you catch it early.
Well, and I know that, you know, I think it has to be emphasized that these are free screenings, you know, and for people who might be uninsured or be underinsured. Talk to me a little bit about how important it is for that segment of the population to get tested.
Well, it is very important to talk to your physician about it. If the doctor doesn't tell you, you need to ask it yourself. And if you don't have insurance, definitely look up this information on the website or the phone number, the 215-1234 number, where you can get information on where these screenings are provided. It is very easy to get a stool sample and look for any blood in it. And for those patients who don't have insurance, the Cancer Center does help them to get some screening for the colon cancer. And it is to increase awareness when most people know about it, that they can, and there are some myths about it, about the PrEP, and there are a lot of easier options that are available now. So if you ask your doctor, we'll always work with them. We do not want patients to be held back because of that. And sedation is very good. So all those things are the concerns that keep patients from getting their colonoscopies, and that's what we want to dispel. And also provide access to patients who are diagnosed with latest clinical trials as well. Since March is Colon Cancer Awareness Month coming up, we also have a Get Your Ear and Gear run, the 5K run at Pennington on April 27th. So everyone that had a family member, survivors, everyone will be recognized when they come there for the run.
That's a fantastic name for an event. That's really funny.
Exactly.
I know it's going to do a lot to promote awareness. Tell everybody, you know, where they can find out more information about the screenings and about the run itself.
The website itself, the marybird.org/OLOL. We can find more information about the screenings and more information about colon cancer itself and its prevention and diagnosis.
Fantastic. Thanks for coming on and giving us the scoop on that. Glad to have you on.